So once again, we have two kinds of composite. We have the pretty flowable that I showed for front teeth and some of the techniques that we do with the biochromatrix. In the posterior, this flowable composite allows us to do some beautiful things. And when this composite shrinks, it absorbs the stress, and under the microscope, I was so impressed that the margins, under the microscope, there were no white lines, there was no stain. This is a beautiful material deep in posterior teeth for buildups and to provide that first layer and to use basically as a base. Alright, so let's take a look at some of these charts. This is the book filled with flowable. It has a fair amount of shrinkage. It's 3%. That's not the benefit. That's a lot of shrinkage. What happens with these composites is when they shrink, they absorb the stress and they don't pull away from the margins. So it's not low shrinkage, it's low stress, and it works. I am so impressed with this. I'm so glad to have this in my practice today. You take a look at some of the other shrinkage. It's fairly consistent. That's a lot of shrinkage. Anything that's above 1% is going to create a problem unless they mitigate the shrinkage by having low stress. So this has low stress, but they all have fairly high shrinkage. So here we are looking at some of the shrinkage of all these bulk fill flowables or bulk fill restoratives. And this is the key right here, shrinkage stress. In other words, this is cuspal deflection, or how much does it pull the cusps together. And this is fairly low. This is a fairly low cuspal shrinkage, or cuspal deflection. So this is what we want to see. Now you see a couple other bulk fills up here, and these are okay. I used to use SureFill SDR, and it was the first good low stress flowable. I don't use this anymore because it's so weak. And if you put any of this on the margins, which always happens, it has terrible wear resistance. It's more sort of, it's like almost like a temporary flowable, but it has good stress mitigation. But I don't use this anymore because it's not strong enough and because it does not have good wear resistance. So we've moved on from that. So shrinkage stress, this is great. Look how low the shrinkage stress is compared to some of these other traditional flowable composites. So there's not even a question, folks. If you're in the back of the mouth and you've got a cavity on dentin, I'm going to put this flowable, the bulk fill flowable 3M down first before I injection mold anything over top of it. I'm going to put it in deep in the cavity, cover the margins. It's fabulous stuff. It's just not very aesthetic, and that's okay. It's deep in the posterior. It's usually not visible. So that's where we are today. We need two flowables, doctors. We need a low stress flowable, and the aesthetics are not so great on that. So that's in the back of the mouth, and in the anterior, we're going to be using the pretty flowable composite, the traditional flowables, like we have, like we've talked about previously.